Reform Action Committee. This time, a year ago, Animal Care Centers of New York asked the Council for $15 million in funding under its services contract with the Department of Health. Unfortunately, ACC came up $2.2 million short, hobbling its efforts to keep its animals safe from disease and healthy enough to be adopted, rather than their being transferred sick to rescue groups. The recent avian flu crisis, which had the potential to morph into a grave public health crisis, highlights the problems faced by an underfunded ACC. The DOH shouldn't play chicken with the ACC's budget. By that I mean that the DOH shouldn't be sitting there hoping that private charities will step in and make up any budget shortfall. That's now not how the ACC should be funded. We thank Mayor de Blasio for promising major capital improvements for the ACC. Promised renovations to the existing shelters and the creation of new shelters will go a long way to keeping animals healthy. But the fact is that those capital projects are years and years away, as you, Chairman Johnson, noted. What's the ACC to do in the interim without proper annual funding to operate? That's why Shelter Reform urges that the ACC funding for fiscal year 2018 be increased to at least $15 million. I note that the Finance Division report prepared for this hearing states that animal control funding will be $15 million. That phrase, animal control funding, as Chairman Johnson noted, is misleading. It is not the same thing as ACC funding. The DOH proposes to pay far less than $15 million to the ACC. The finance report also offers as a performance indicator the DOH's efforts at dog licensing. Using that same metric, the DOH gets a failing grade. Dog licensing compliance continues its downward plunge. For example, in 2010, the DOH reported that 100,000 dogs had been licensed, which the DOH calculated to be a 20% compliance rate. Now, only 86,000 dogs are licensed. I submit that dog licensing is an indicator of the DOH's lack of commitment to animal health, which can directly affect human health. A licensed dog is a rabies-vaccinated dog. The DOH fails when potentially hundreds of thousands of dogs go unvaccinated. And yes, you should also look into the DOH's enforcement of the pet shop law and how much money it's taken in taxpayer dollars not to enforce it. And I hope we'll have a special hearing about this soon. Thank you.
Good afternoon, and thank you, Chairman Johnson, for the opportunity to comment on the budgetary funding for Animal Care Centers of New York. I'm Bill Sacre, the Legislative Director of the League of Humane Voters of New York. We attended the recent ACC board meeting and were most disappointed to learn that the DOH announced new adoption center in Manhattan and the new HVA system for Brooklyn are still 3 years away after being announced in January of 2015. We applaud the mayor and the council for the funding of planning and development of new shelters for the Bronx and Queens, but we're more than 5 years away from the opening of both, again, per the DOH. We feel strongly that AC&C be fully funded in the proposed budget. The AC&C team has made enormous progress under the leadership of Ms. Weinstock, its executive director. However, with antiquated facilities and improvements years away, anything less than full funding is a disservice to the animals and people of New York City. Thank you.
Hello, my name is Adelia Honeywood. I am a cat rescuer with Brooklyn Cat Cafe. I live in Councilmember Eugene's district, where over several years I've spent a lot of my spare time and my own dime doing trap, neuter, release with feral cats in the neighborhood. I echo what has been said here about the need to increase funding both in the contract and the capital plan for ACC, because the function or dysfunction of our shelter system is not just an animal welfare issue. It is a human welfare issue that affects the emotional well-being of New Yorkers and their quality of life on the streets of their neighborhoods, especially for more vulnerable populations. As they have said, ACC has worked very hard and made great strides, but they operate on a meager budget in antiquated facilities, and the reality is that healthy animals are still killed for lack of space, or they contract life-threatening illnesses after entering the shelter. What this means is that New Yorkers don't have a shelter system they can trust in times of crisis. Rescuers get so many pleas from people in dire situations. Maybe they've been evicted, they've lost a job, they have a serious illness, and they can't care for their pet anymore. And the last thing they want to do is send their beloved companion to its possible death in the shelter. And rescuers can't take them all. And people have said to me, well, I'd rather my cat chance it on the streets. And let's say that cat isn't spayed or neutered, because it's really expensive to spay or neuter, and the low-cost spay-neuter services are often very hard to access. So that cat makes hundreds more, and you have streets full of suffering cats, and it's a public nuisance to some, and a daily heartbreak to others, or maybe both. And if someone 6 months earlier could have taken their cat to ACC with confidence that it would come out alive, there'd probably be a lot fewer cats on the streets. When I moved to my neighborhood in 2007, there were cats everywhere. You saw emaciated cats in sub-zero temperatures pawing the garbage. You saw sick kittens dying on the streets or with eye infections that had turned their eyeballs to mush. And it's a heartbreaking thing to walk through every day. And that was Ditmas Park, which is a pretty affluent neighborhood. And in less affluent neighborhoods, the situation is 1,000 times worse, and there might not be people who can take on TNR on their own. So in order to truly help people and their pets, as they have said, ACC needs the full funding. They need the new shelters and the renovations much faster than on a 10-year timeline, and we just urge the city to step it up. Thank you.
I agree with everything you all have said. I'm pushing. I keep pushing. They deserve more money. They need the money. The shelters should be done already by now, actually. Should have been done a long time ago. So I'm with you in this fight, and we'll keep pushing. Thank you very much.
Thank you.
Okay.